One of revulsion. Despite what the president says, this bill raises costs, lowers quality, and kills jobs. That's a trifecta we in Michigan and the rest of America cannot afford in this difficult economy. Well, obviously the reports stem anywhere between $1 to $3 trillion. And when you look at what's happened with the $1 trillion stimulus, it was rushed through and is yet to work to get Americans back to work. You see the failed cap and tax, national energy tax that was passed would be in the trillions. You have to take your time, do this right, and have real reform. Unfortunately, it's going to be another rush job. It's going to cost trillions of dollars. And with America not only deep in recession, but deep in debt, this is one of the worst things we could do for our economy and for the well-being of all Americans. Well, I think it's an arbitrary deadline set by an administration that already has once been burned by a $1 trillion stimulus with an artificial deadline for passage, where their own members didn't read it before they voted for it. I think you saw a rush to do a cap and tax bill before the American public could find out why it would have disastrous consequences, not only for their jobs, but for their way of life. And again, for the third time, we're seeing an administration set an arbitrary deadline to have a radical socialization of America's healthcare sector. And unfortunately, if things continue apace and legislation is enacted and passed into law, you're going to see equally dire ramifications for the American people, comparable to both the stimulus and potentially to the cap and tax that would be passed. We are right where the president is. As you notice, the president of the United States has made this his latest #1 priority, as opposed to putting people back to work. The president has a position. He has no formal plan. What the president has said is that he has a concept for a government-run option for health care, which, as we all know, would lead to health care by the government, period. The president has not put forward any concrete proposals. He is waiting to see what the Democratic House members do and see how those pieces of legislation accord with his position. And I think the Republicans are doing the same. What Republicans want to do is see the supply of health care increased. If you increase the supply, it will rise to meet the demand. You will see cost stabilization, you will see patient-centered wellness, and you will see people empowered as consumers within the healthcare sector in the same way they are throughout every facet of the economy in the age of globalization. It would still affect all Americans the same way. What you would see is increased cost, lowered quality, and job-killing regulations by the government. What you're really looking at in Michigan with a 15.2% unemployment rate is the reality that this administration has moved on to other items rather than focus on fundamental problems within our economy, such as the housing foreclosure crisis, the pending commercial real estate crisis, the credit crisis, which is yet to see our frozen credit markets free up, and of course, the accompanying job loss that comes with it. In Michigan, we are very concerned about jobs. We're losing manufacturing jobs at an alarming rate. The announced job loss that will occur, both with Chrysler and GM, have yet to be fully implemented. The supply chain has yet to be fully radically restructured by this administration to meet the smaller companies, GM and Chrysler, Fiat. And we have dealerships that are also going to lose jobs. Our key concern is jobs in Michigan. Now, the first stimulus bill didn't work. Unlike Vice President Biden, I disagree with his premise that we have to keep spending to keep from going bankrupt. I think that that's insane. So I would say that if you're in a hole and you're already digging it deeper, you don't need a second shovel to come in and help finish the job. No. If you look at a 15.2% unemployment rate, what you're seeing is that the stimulus bill was not to get the private sector growing to keep long-term sustainable jobs. It was a temporary measure, and it turned out to be a government bailout bill. This is not good for the long-term health of the United States. It's certainly a poor investment for the thousands of dollars that it has put on every man, woman, and child in the United States in terms of long-term debt. So even in the short run, it's a focus at a government trickle-down theory that has not worked, and by its own admission, both in asking for a second stimulus bill and, more importantly, by not staying below the 8.5% unemployment rate this administration promised if the stimulus was passed, you can see that this was not well done. It was rushed. It has not proven helpful. It is failing. And this is most unfortunate for the American people, not only because of the near-term and potential long-term loss of jobs or failure to have job creation. This is $1 trillion in debt that has been amassed on the American people, and it has not worked.